Hello everyone, welcome back to my channel Nutrition Talk with Angona. How are you? I hope all are good. Yeah, so me also fine. So today we are getting a new topic, that is it's all about diabetic. So before starting the topic, you have to know what is the meaning of diabetic or what is diabetic. Diabetic is a condition that happens when your blood sugar is too high. It develops when your pancreas doesn't make enough insulin or at all, or when your body is not responding to the effects of insulin properly. Diabetics affects people of all ages. Most forms of diabetics are chronic and all forms are manageable with medications or lifestyle changes. One term which is nearly related with diabetics, that is glucose. Glucose have an important relation with diabetics. So glucose mainly cause of diabetic, and glucose mainly comes from carbohydrates in your foods and drinks. It's your body's go-to source of energy. Your blood carries glucose to all of your body cell to use for energy. When glucose is in your bloodstream, it needs help a key to reach its final destination. This key is insulin, which is a hormone. If your pancreas is not making enough insulin or your body is not using it properly, glucose builds up in your bloodstream, causing high blood sugars. That is known as hyperglycemia. Over time, having consistently high blood glucose can cause health problems such as heart disease, nerve damage, and eye issues. Okay, so technically, the name of diabetic is a diabetic mellitus. Another condition shared the term diabetic, that is diabetes insipidus. As we all know, diabetic is a complex condition. So for that reason, we need to monitor the disease. I mean, we need to diagnose the disease. Either we can't able to know what is our blood sugar level, blood glucose level in our body. So for that reason, we need to diagnose. The one is a fasting blood glucose test, and another is HbA1c, which is in nowadays. So fasting glucose test is a test. You don't eat or drink anything except water for the test at least 8 hours before the test. Okay, fast food can greatly affect blood sugar. The test allow you provide to see your baseline blood sugar. Okay, and another one is HbA1c, which also provides your average blood glucose level over the past 2 or 3 months. Okay, next is actually what is the normal level. Suppose in your fasting blood glucose test result is, the range of test is, suppose you are in less than 100, that means it's range. Okay, suppose you are in like 100 to 125 mg per dl, definitely this is the unit for diagnosis the test. So this conditions is basically known as pre-diabetic conditions, and suppose you are in more than 126, that's actually known as diabetic condition. I'm talking about fasting part, fasting plasma glucose level. Okay, and oral glucose test or oral glucose tolerant test level, suppose you are crossed in like 200 or above, that means you are diabetic. Suppose your level is 140 to 199, that means you are in pre-diabetic condition. Suppose your level is 139 or below of 139, that means you are in the normal condition. Now I am coming to the HbA1c result, or the percentage. Suppose you have the range that is 6.5 or above, then you are in the diabetic condition. Suppose your range is 5.7 to 6.4, that means you are pre-diabetic. And if your range is less than or about like 5, then your you are in the normal condition. By that way, we can identify the exact condition in our body. This is the way how we can recognize the disease. Now it's time for types of diabetics. So we can classify the diabetics in a different way. The most important types are type 1 diabetics, type 2 diabetes, gestational diabetics and pre-diabetics. These are the basic and the main types of diabetics. Around 95 to 90%, near about 90 to 95% of people diagnosed with diabetics have type 2 diabetics, okay, and around 5% to 10% people have diagnosis with type who have type 1 diabetics. There the other types of diabetics is also there, like MODY, that is maturity onset diabetics of the young. Neonatal diabetics is also there. And next one, LADA, that is latent autoimmune diabetic in adults. Okay, these are the different types of diabetics. There is different type of risks we can see in different diabetic. Like for example, in type 1 diabetics we have a different risk, and type 2 also. In type 1 diabetics, the body makes no insulin or not enough of the hormone. This condition occurs, it's around 5% of those with diabetics. So the risk factors are basically, main risk factor is family history. Having a parents or sibling with type 1 diabetics increase the risk of a person having the same type. If both parents have the type 1 diabetics, the risk is even higher. And second one risk is age. Type 1 diabetics usually develops in younger adults and the children. It is one of the most common chronic conditions that developed in the childhood. Children are typically younger than 14 years old. When they receive a diagnosis, type 1 diabetics might occur at any age, although developing type 1 diabetics later in the life is rare. Next one is genetics. Having a specific genes may increase the risk of type 1 diabetics. A person's doctor can check for this genes. Next is type 2 diabetics. Type 2 diabetics is most common forms of diabetics. In type 2, the body can still make some insulin, but it's not able to use the hormone as effectively as it should. Insulin usually allow cells to absorb glucose. However, the cell can become less sensitive to insulin, leaving more sugar in the blood. If blood sugar is permanently high, a person may have developed type 2 diabetics. An increase in blood sugar can lead to damage in the body. Type 2 diabetics often moves through a stage called pre-diabetics, during which a person can reverse the progress of this condition with a healthful lifestyle choices. So type 2 diabetics have different types of risk, like frequent infection, blurred vision. Okay, so these are the basically risk of type 2 diabetics, sometimes depressions. So these are the basically risk of type 1 and type 2 diabetics. So what is the differences between type 1 and type 2 diabetics? That is basically, first you need to know what is type 1 diabetics and what is type 2 diabetics and all. Type 1 diabetic, this type of diabetics is actually, this type of disease is actually autoimmune disease in which your immune system attacks and destroys insulin production and producing cells in your pancreas for unknown reason. Up to 10% of people who have diabetics have type 1 type of diabetics. It's usually diagnosed in children and young adults, but it can develop at any age. This is type 1 diabetic. So a little bit I'm giving you the information about autoimmune disorders or autoimmune disease. Your immune system is made up of organs and cell meant to protect your body from bacteria, parasite, virus and cancer cells. An autoimmune disease is the result of immune system accidentally attacking your body instead of protecting it. It's unclear why your immune system does this. There are over 100 known autoimmune disease. Common one include lupus, rheumatoid arthritis, chronic disease and all. Autoimmune disease can affect many type of tissue and nearly any organ in your body. They may cause a variety of symptoms including pain, tiredness, rashes, nausea, headache, dizziness and more. Specific symptoms depend on the exact disease. So this all about type 1, and type 2 is what? Type 2 is this type. Your body does not make enough insulin and your body cells don't respond normally to insulin. That means insulin resistance. Yes, this is the most common type of diabetics. It's mainly affect adults, but children can have it as well. So basically, if we talking about type 1 and type 2 diabetics difference, so we can see clearly, that type 1 is this kind of diabetic which is basically cause of they can't able to produce proper amount of insulin, and type 2 they are producing insulin but due to some reason our body can't able to absorb this kind of glucose and all. And who are facing this problem? Basically in type 1 children, young category people are facing this disease, and type 2 means is aged person, I mean more than 40 or like this kind of people who are facing this kind of problem. So here one term is coming that is with which is related to type 2 diabetic, that is insulin resistance. Let me clear you the term. Insulin resistance meaning it is a complex condition in which your body does not respond as it should to insulin, a hormone your pancreas makes that's essential for regulating blood sugar level. Severe genetic and lifestyle factor can contribute to insulin resistance. Which insulin resistance is also known as impaired insulin sensitivity. Happens when cells in your muscles, fat and liver does not respond as they should to insulin, a hormone your pancreas makes that's essential for the life and regulating blood sugar level. Insulin resistance can be temporary or chronic and it is treatable in some cases. Okay, so this is the basically meaning of insulin resistance. Now another type, that is this is the basic difference between type 1 and type 2 as I am clearing with you. Next some other type I am discussing with you, that is actually pre-diabetic. What is pre-diabetic? I'm going to the previous slide where I'm showing you the different types of diabetics. So once again I'm explaining this here. Pre-diabetics, it's just a types, is a stage before type 2 diabetics. Your blood glucose levels are higher than normal but not high enough to be officially diagnosed with type 2 diabetics. Okay, this is pre-diabetic condition. Next is gestational diabetic. Gestational means pregnancy time actually. The types developed in some people during pregnancy. Gestational diabetics usually goes away after pregnancy. However, if you have gestational diabetics, you are at higher risk of developing type 2 diabetics later in life. Another types of diabetics is also there, like type 3C diabetics. It is a form of diabetics, happens when your pancreas exercises damage. other than autoimmune damage which affect its ability to produce insulin, like pancreatitis, pancreatic cancer, hemochromatosis can leads to pancreas damage that cause diabetics. Having your pancreas removed also result in type 3C diabetic. Next one, LATD, that is latent autoimmune diabetics in adult. It's like type 1 diabetics. LADA also result from an autoimmune reactions, but it develops much more slowly than type 1. People diagnosed with LADA are usually over the age of 30. Okay, next is MODY, that is maturity onset diabetics of the youth. It's also called monogenic diabetic, happens due to an inherited genetic mutation that affects how your body makes and use insulin. There are currently over 10 different type of MODY. It's affect up to 5% of people with diabetes and commonly runs in families. Okay. Next one is neonatal diabetics. This is a rare form of diabetics that occur within the first 6 months of life. It's affect a form of monogenic diabetic. About 50% of babies with neonatal diabetic have the long life form called pre-manic neonatal diabetic. For the other half, the condition disappear within a few months from onset, but it can come back later life. This called transit neonatal diabetes mellitus. These are the another types of diabetics. Who are diabetic patient, they are facing some symptoms before the disease, like for example increased thirst, which is known as polydipsia, and dry mouth. Next is frequent urination, fatigue, blurred vision, unexplained weight loss, numbness or tingling in your hands or feet, slow healing sores or cut, frequent skin or vaginal yeast infections. These are the symptoms which we can see in the conditions of diabetes. So, the basic cause, if you are describing about the causes of this diabetics, is insulin resistance, which I have already discussed, autoimmune disease that is related with your type 1 diabetics, and insulin resistance, which is your type 2 diabetics, and third one is hormonal imbalance, which is basically patient is facing in these conditions of pregnancy, which is gestational diabetes. Next one is pancreatic damage. Pancreatic damage due to some reason when your pancreas is damaged, can't able to produce proper amount of insulin. On that reason, some time of surgery, some time of autoimmune disorders, some time of any kind of injury, any kind of other conditions when pancreas can't able to produce proper amount of insulin. In this condition, we also can face this disease. And the last one is genetical issue. Suppose in your family, if you have in your family members, if you have diabetic, then you have a chances. Already I have discussed about this one. So this is the basically reasons of this disease. Okay. Here is some question. What happenings in your body in type 1 and type 2 diabetics? As type 1 diabetics, the body start attacking your pancreatic cell. As a result, it doesn't produce insulin. In type 2 condition, your body is not able to utilize insulin the way it should. Slowly, the amount of insulin production reduced. Is it manageable? Your body in type 1 condition, you may be asked to take insulin to help with type 1 diabetics. in type 2 condition, in addition to sometime being asked to take medication, in advanced cases you may also need insulin. Lifestyle changes like diet, exercise, and sleeping, stress relieving, some management, these all are there, can also have a positive effect. Can this be cured? The key here is to manage blood sugar level with insulin. It can lead to severe health complications, even be fatal in the type 1 condition. In type 2 condition, with the right treatment and the lifestyle changes, type 2 diabetes can be managed. In some cases, even remission or reversal is a possibility. If you can able to manage diabetic, then also you can protect this condition. So what are the way? How can you control or how can you manage diabetic? First of all is blood sugar monitoring. Monitoring your blood sugar level, glucose level, is the key determining how well your current treatment plan is working. It's give you information on how to manage your diabetics on a daily or sometimes even hourly basis. You can monitor your level of frequent checks with a glucose meter and finger stick or with a continuous glucose monitor. You and your healthcare provider will determine the best blood sugar range for you. Next one is oral diabetic medications. That is, oral diabetic medication, that means take medicine, take by mouth. Which type of medicine we are taking through mouth help manage blood sugar level in people who have diabetics but still produce some insulin, mainly people with type 2 diabetics and pre-diabetics. For this patient we are giving the medicine. People with gestational diabetic may also need oral medication. There are several different types. That is, metformin is the most common thing. Next is insulin. People with type 1 diabetic needs to inject insulin, synthetic insulin to life and manage diabetics. And that some people with type 2 diabetics also require insulin. There are several different types of synthetic insulin. They each start to work at different speeds and last your body for the different length of the time. The four main way you can take insulin include injectable insulin with shot, that means with syringe. Insulin pens is also there. Insulin pump is there, and rapid acting inhaled insulin is there. Okay, and next one is a diet. Diet is a very important part. Meal planning and the choosing a health diet for you are the key aspect of diabetic management, as food greatly impact your blood sugar level. If you take insulin, counting carbs in food and drink you consume is a large part of management. The amount of carbs you eat determine how much insulin you need at meals. Healthy eating your weight and healthy eating habit can also help you manage your weight and reduce your heart disease risk. Next one is exercise. Exercise is a very important part. Physical activity. Suppose you are taking your proper diet, medicines, you are doing everything, but still you are sitting in one place for a long time, or you are not a positive worker. Okay, you are just not maintaining proper lifestyle. Then the medicine will not work properly. So for that reason, you need to do exercise at least little bit according to your age wise. Physical activity increase insulin sensitivity. Okay, so regular exercise is an important part of your management for all people with diabetes. Your target should be maintaining your weight, blood pressure, and the cholesterol level. So these are the basic things. By that way, we can able to manage our diabetic condition. We can cure this condition. So start your new life with targeting these all points, like monitoring your blood glucose level, oral diabetic medicines, taking insulin if you need, diet, and exercise. These all the little things. By that way, you can change your life fully. Okay, thank you for listening these all things. Next video we will discuss about depthly about the diet. That means what type of diet you need to maintain for preventing this kind of disease for type 1 and for type 2. But for today, up to this, thank you for watching. Bye bye, keep watching, and don't forget to subscribe our channel. And if you are learning something from my video, then you can like and you can share and subscribe. Bye, see you again in next video.